Hi, so I'm here to tell you a little bit about the Adrenalin auto-injector. Some people just call it the Epi-Pen. That's a sort of trade name. So Adrenalin auto-injector is like the proper name for it. Inside an Epi-Pen is adrenaline. There's not a huge amount of adrenaline. You can see here there's 300 micrograms. So that's not loads, but it is enough to help you if you're suffering with a severe life-threatening allergic reaction called anaphylaxis. One thing of note is that adrenaline has got a very short half-life. So if you are suffering yourself, or you know someone else who is, or you think someone else is suffering with anaphylaxis, then we need to give one of these as quickly as we can into the lateral aspect of their thigh, and be prepared to give them another one in about 3 to 5 minutes. Because of the half-life, this will get used up quite quickly in the body, so it will work quite quickly, but it won't last very long, and that's one of the keys. So if you ever have to use one of these, please, the aim of this video is to show you how easy it is and how sort of safe and how sort of anyone can do this. So please don't be alarmed, don't be afraid, use it, that's what it's for, and afterwards be prepared to use another one. So I've kindly been donated an out-of-date pack here today. It is live Epi-Pen. I just wanted to show you actually what a real one does. If you're on one of our courses, you'll be given the opportunity to play with some sort of fake ones. When I say play, I mean sort of have a look at them, expose them, and sort of see what it's like. But I just wanted to show you a real one in action. So I've got a empty bottle here, totally empty, a couple of a bit of mist in there, lid on, and a fake bit of skin here, the latex. And so I'm going to put the bottle in the latex, and this is what we're going to sort of assume is our leg then. So the outer lateral aspect of the thigh, that's where you want to sort of aim for. Basically you want a big muscle, and so the biggest muscle is around your sort of gluteus maximus. That's what it's called. That maximus is massive, and so yeah, around that lateral aspect of the thigh. So if you or someone else suffers with allergic reactions, you may be prescribed these. People should always carry about 2 of them on them, and that's purely because of the half-life is very short. And so they may carry them in a box like this, or they may have taken it out of the box, ditched that, and just sort of carry it around in a sort of sealed plastic bit like this. So as a first aider, you are allowed to ask someone if they've got an Epi-Pen. You're allowed to look to see if they've got one if you think they're suffering with anaphylaxis. Our trainers today will tell you the signs and symptoms of all that. I'm just here today to show you actually how it works. So basically you can get it out of this sort of plastic case, no problem, and ditch that. And that leaves you with this thing. So it's pretty much identical to the practice ones you'll be shown today. You'll notice there that there's no sort of sharp protruding, so it is quite safe to get it out and to hold it and to feel it, it's sturdy. On it you'll see the instructions, so it just literally says 1, 2, 3, and so pull off the blue cap, hold the orange tip approximately 10 centimeters from the outer thigh, and jab firmly into the outer thigh, and listen for a click, and then you hold it firmly, sort of still depressed, for about 3 seconds. Then, if you haven't already, dial 999, ask for an ambulance, and try and remember that word, anaphylaxis. That means a life-threatening emergency reaction. And so if the ambulance services call handlers hear that word, they will give you the fastest level of response for an ambulance that they can get. Over on the other side, it shows a bit about the ingredients and storage instructions and stuff. So that says needle end, and we'll show it in action now. So remember, in here I've basically got an empty plastic bottle and some latex skin. I can't do anything that end, even if I wanted to, I can't. What I've got to do is just follow the instructions, pull off the blue safety cap. So you pull that off, and that's what it looks like, just like the practice one you'll be being shown. And that basically means it's now armed, if you like, for want of a better word. So remember, try and find a good bit of thigh, a good bit of sort of muscly tissue, and then from about 10 centimeters, you just basically depress down in a sharp fluid motion until you hear a click, and you hold that for 3 seconds. So I'll do that now. 1, 2, 3. Okay, so instant reaction, no sharp still. This is what we call a sharp safe. That means, you know, good, because you can't jab yourself. Always still be careful. You could, if you wanted, put that back in there. It makes no difference because you can't use it twice. It's a single use only thing. And even if I sort of jab it on my workbench here, it makes no difference. So that's the sort of thing that would be good now to keep, to be able to show the ambulance crew when they arrive. You'll notice again, no little hole visible. It's literally a fine needle that pokes out and then disappears. And so there's very little sort of evidence of any puncture through your skin. You may see a little speck of blood or something, but you know, literally it'll be a speck. You're talking about the same sort of size if you were to nick yourself shaving. Now, if you look at the bottle in here, can you see in there? There's down in the bottom there. There's literally just a fine sort of mist of water. I'll try and sort of go underneath there. That's it. That's it. That is literally it. So you've seen it in action now. You see how little of this stuff there actually is. And try and sort of shake it down to the bottom so you can see there. It's literally very, very small volume of fluid. That fluid is essential for helping people with anaphylaxis. It's adrenaline, and it works in 3 ways. The first way is it shrinks the sort of blood vessels and stuff in your arms and your legs, pushing all your blood to your core, and that's really good because that can prevent sort of further swelling. When people swell with anaphylaxis, it's generally because their blood vessels have dilated a bit, and then fluid can leak from their blood into the tissue around them and around the mouth and nose and stuff. So by shrinking those vessels, that's really good. It can prevent further swelling. Adrenaline can also increase the diameter of the smooth muscle in the bronchioles, which is tubes in the lungs. So basically it means the person will be able to breathe more easily. And the third thing that adrenaline does is it makes your heart beat faster and harder. So if you've got, if you're having anaphylaxis and your blood vessels have dilated, then you will be have low blood pressure. And so therefore, if we can shrink those blood vessels again by giving them adrenaline and increase their heart rate so it beats faster and harder, then it means their blood pressure will increase. So adrenaline is brilliant treatment for anaphylaxis. The benefits of its use far outweigh any risks, so please don't be scared of it. You've seen how easy it is. It's literally that easy. You just sort of push it on, hold it, and you've done your job. However, be prepared for the person to show a little improvement, but then after about 3 to 5 minutes, they may start to decline again.
And if that happens, and if your patient starts to deteriorate again, you can give them another auto-injector within about 3 to 5 minutes of the first one. And that'll buy you a bit more time until the ambulance gets there. Then you can lower the patient down, try and raise their legs. That will increase their blood pressure. Keep them calm, obviously keep gaining attention. The ambulance call handler will have stayed on the phone with you. If you dial 999, they generally stay on the phone until the ambulance gets there. So speak to them, tell them what's happening, keep them updated, and they'll do the same to you. So I hope you found this little video informative, showing how easy it is to use this device, how you shouldn't be afraid of it, and how good it can be at treating anaphylaxis.